It's another episode of the Talk Matters Health Corner. Today we continue with our discussion of diarrhea as we started in the last episode. Specifically today we'll be having a look at the signs and symptoms of diarrhea, the preventive measures that we have to take, and more importantly, what to do when we have diarrhea. We discussed in our last episode that diarrhea is a very severe condition of the gastrointestinal system because of the issue of dehydration, which is one of the um, most serious complications of diarrhea. But what are the signs and symptoms of diarrhea um, available? Of course, the very first one is the passage of loose watery stools. Basically, these stools are very frequent, and within the day, as we said earlier on, you could pass more than three, four, five of them. And when you have something like that, it's a clear sign that you are having a case of what? Diarrhea. The frequent passage of the loose stool could come with some abdominal cramps or abdominal pains. And also, because of the stools. You could also have some vomiting also being associated with the passage of the loose stool. Don't forget also that the vomiting could be preceded by the feeling of vomiting or what we call nausea. There could be some associated rise in temperature or fever, and you could also have um, some blood or mucus in the what? In the stool. And these are all clear indications of diarrhea. One other basic important symptom of diarrhea is because you are losing a lot of water from the body, the amount of water that will come out of the body in the form of urine will go down. So your urine output is actually going to do what? To go down. And because water also forms about 70% of the body, you realize that if you have your water in you being lost a lot of the time due to the passage of loose, frequent watery stool, your weight will actually do what? Will go down. And very last but not the least are the signs of dehydration. You say that when you pinch your skin and you pull it up, the rate at which it goes back is very, very slow, indicating that there could be some severe loss of water in you. Also, you have your eyes dropping back. That is what we call described as sunken what eye. Dryness of your tongue also showing clearly that you may be having some issue of what? Of dehydration. So basically, these are the signs and symptoms of what? Of diarrhea. I must also say that you could have some rectal mass as a result of the frequent passage of stool. Every day the rectum is having an activity to do, and it could prone you to having some rectal what? Mass. Question now is, how then do we prevent diarrhea? It's basically an issue of dealing with hygienic conditions. So it's more of taking care of hygiene. It could be environmental or it could even be what? Personal. So the very first on the list is to ensure that you have environmental cleanliness. So you make sure that you keep your surrounding very clean so that you are not picking a lot of germs in the environment into your body through the food and then water that you are taking in. Also, you, the person individual or the individual, will have to also ensure that you have a total cleanness of your body or what we call personal hygiene so that you don't expose yourself to these causative agents or these microorganisms that will lead to diarrhea. And also, you avoid taking contaminated water and contaminated food. Very, very important. A food you are going to take, especially when it is cold, it is advisable not to take it because you wouldn't know the active microorganisms that are in there and what problems they stand to pose to you. So you ensure that the food, water you are going to take is what? Is very, very, very hygienic and it's one of a top notch. If you are a mother and you have a very fresh baby, you ensure that you exclusively breastfeed the child. Reason being that if you introduce water to the child at an early age, the child will stand, because of the low immune system, the child will stand the possibility of being infected by these disease causing organisms in the water or any other food substance you introduce to the child, and it could be detrimental to the child also. Also, if you want to eat, wash your hand very well with soap and running water, possibly just like about 10 to 15 seconds. And you wash fruits, you wash vegetables, you wash raw fish, meat and stuff that you want to use. You have to wash them very well before you use, so that you get rid of all the germs on it. Then what then do I do in case I have diarrhea? This is the most important aspect, and this is where a lot of people will have to, because a lot of us at one time in our life might have experienced diarrhea, and you don't just know what to do, and you're like, you are possibly some far distances away from the hospital. What do you have to do if I have diarrhea? Some very simple interventions. You ensure that you take in a lot of fluid, because you are losing fluid, taking a lot of fluid. If you have access to coconut water, you can take it, because it is more of an electrolyte, and it replaces the various electrolytes that you are losing from your body. And also, if you have access to oral rehydration salt or the ORS, you could dilute some and you take it. Normally, the one sachet is supposed to be taken within 24 hours, but it's not supposed to be taken overnight. So when you prepare it and it is till the night, like about 12 a.m., you cannot take it again. You have to discard it and prepare a new one for the following day. And also, you ensure that you maintain adequate nutrition. Some people have the belief that because they are losing a lot of stool, they don't want to eat again. But you ensure that you maintain adequate nutrition as you can tolerate. And also make sure that you don't take in solid food. Most of you take in liquid food, because these liquid foods will contain water, which is going to replace the water that you are losing through the stool, and it will help to solve the problem. Also, you may like to also ensure that you don't engage in taking a lot of caffeinated and carbonated drinks, because they could also harm a lot, and they draw a lot of water into the system, and then they pass a lot of water, so it aggravates the cause of the diarrhea. And also, one other last thing is you avoid dairy products. Anything milk and it associated with it, you avoid it, and you ensure, so that, because they are easily contaminated by, what do we call it, microorganisms, and they could cause a lot of issues for you. So you try as much as possible to practice these methods whilst at home. And another thing too you could also do is, we have a simple way. If you don't have access to the ORS, we have a simple way you can prepare ORS in the house, where you could just take a teaspoonful of salt, and then about 2 tablespoons of water, no, of sugar. You mix the two in a 1 cup of water. You stir it, mix it, and then you take, and it will, of course, cause a lot of electrolytes to go into the system, which are going to bring down the issue of what, of diarrhea. This is all you have to do to take care of what, diarrhea. It's a good time to say a goodbye to you. We've been looking at diarrhea, classes, causes, how diarrhea is caused, and then the signs and symptoms and the preventive measures available. I'll come your way another time with another exciting episode on the Top Matters Health Corner. Till I come your way, do share, like, subscribe, and comment. Thank you.